All right, here is a couple exercises that I put together when you have that nagging pain kind of right along your belt line, um, right kind of either offset to the left or the right of your back. So I am going to teach you how you can get that joint moving, because oftentimes it gets stuck after it has been overstressed and doesn't move properly. So what you're going to do is you're going to take either a yoga block or a pillow that's a little bit firmer, anything that you can replicate about the width of the yoga block this way. And you're first just going to put it between your knees, okay? And all I want you to do is exhale, pull the belly up and in as you squeeze the block, about 40% of your full strength. Inhale, exhale, squeeze the block. Go through that about 5 to 10 times, okay? And the next thing that you're gonna do is you're gonna do a little bit of a hip lift. It doesn't have to be major, just kind of unweight your hips from the ground to reset your pelvis, okay? And then what I'm gonna have you do, you can take the block out and just windshield wiper the knees side to side. Sometimes that's all it takes, okay? If you still feel like you're having that pressure in the back, what you're going to do next is you're going to tilt your pelvis, so those two wing bones of your hips. You think about the front points of your hips, kind of the bones that kind of poke out in the front here. And what you're going to do is you're going to bring them and draw them up towards your rib cage as far as you can. That will flatten your back on the mat, and then you're going to push them away from your rib cage down toward your heels as far as you can. So back and forth. Ideally you would inhale as you're pressing the hip bones down toward your heels. Exhale, draw them up toward your hip or rib points. Inhale, exhale. So again, going through those, you want to do as much as you can with your abdominals and back muscles. Try not to get the movement by pushing with your legs, okay? Because that's an easier way to do this. Try to use your abdominals, lower abdominals, to pull up and in, and then your back muscles to push down, as opposed to digging your heels in to push up and down, okay? Again, you can do that little bridge, come back down. If that has already relieved the pain, you can go ahead and stop there. Level 3, okay, so the last thing that you can try here to get that joint unstuck is what I want you to do is called pelvic clocks. So you think about wearing a huge belt buckle, okay, right where a belt buckle would go. And what you're going to do is you're going to make a circle, okay? So again, try not to push with your legs. Try to use your muscles, all right? So if my big belt buckle's here, I'm going to pull up and then to the right, down, to the left, up, and continue to try to make those circles, okay? So your knees can kind of follow along, whatever feels comfortable. You're trying not to move your upper body, try not to draw your shoulders up. And again, use your abdominal and back muscles and kind of feel where things are a little bit harder to move, whether it's to the right, to the left, okay? So do about 10 circles one direction, and then you'll try to go the opposite direction. So think clockwise, counterclockwise. Remember, you're wearing that big belt buckle, trying to move it in a circular motion. Okay? And again, the last thing that you can do is you can do that bridge, okay? You can even do a couple more squeezes like we started with, which squeezing your knees together helps to open up that joint, okay? Great.